Okay, it is with my great pleasure that I introduce Dr. Tracy Gosselin. Dr. Gosselin serves as the Chief Nurse Executive and Senior Vice President and Chair of Nursing at Memorial Sloan Kettering Cancer Center. She also serves as the President of the Oncology Nursing Foundation. Today, Dr. Gosselin will present Supporting Nurses Through Transitions from the Leadership Lens. Welcome, Dr. Gosselin.
All right, good morning to all of you. I hope you can hear me and you can see the slides, which I'll start advancing. I'm really excited to be here with you all, and I want to thank the Planning Committee and the New York State chapter of HIMSS for inviting me. And I want to tell you, Phyllis and I have not met, but we will share some very similar thoughts that hopefully will align as you think about your leadership journey in the lens of how you think about leadership, especially as we do lead through very different times. All right. So I'm very sorry, I can't get off of this slide.
You need to request control, please.
I already have.
Okay. Bill, would you mind advancing slides, please?
Sure, I'm going to stop and reshare it. And then Tracy, if you just say next slide, please, as we go, we can do that.
All right. All right, so we'll hop right over to the next slide. Just some objectives of our time together this morning. We're going to review examples of possible reasons for transitions. You've all lived through this in your career, right? What does it mean to the staff we lead, the leaders we lead, as well as to ourselves? And then we'll talk a little bit about what are those barriers, but more so the opportunities to really move forward to make the changes we want to see. In the next slide. So we're going to talk a little bit on the next slide about reasons for change and reasons for transition today. And I think this is really important because words matter, right? Words matter to those we lead and those we care for. And so on the next slide, why are we talking about practice change? And you all know this probably better than many people. With technology, with so many things changing fast, right? Some of us might remember the days of paper documentation. Some of us might remember living in hybrid approaches. Some of us might even remember, only electronic medical records, right? So there's this great variation we see, but lots of reasons for practice change, right? And when we think about the economics of the United States and our healthcare system, we often think about the quadruple aim, which was initially the triple aim that focused on better outcomes for patients, lower costs, and improved patient experience. The other piece of this really has to do with an improved clinician experience, right? That is our whole team. And when I think about the roles that exist, especially when I think about information technology professionals, the broad umbrella, and yet the nurses who contribute to this, so much of the work you do is trying to solve puzzles of how do we do this better? How do we deliver better outcomes? How do we lower costs? And how do we improve that experience through the patient's lens? Yet, as clinicians, what we also bring, and what you bring more so, is understanding the workflow of using the systems and driving care in very different ways. So 2014, we heard about the triple aim. 2014 really moved forward with the quadruple aim, which I think is really important. And when we talk about improved clinician experience, there's a great article on burnout that did a review of 91 articles, right? And a lot of this, when we think about the improved clinician experience and what our colleagues worry about, what we worry about, is when we talk about burnout and exhaustion and all those different things, especially of what we've had to lead and manage through the past 2 years, we know that leads to reduced job performance, poor quality of care, a variety of other outcomes of how people choose to participate, right? We talk about patient safety, med errors, and I think you, like I, am very aware of the Redonda case at Vanderbilt. And what does a medication error mean within the systems we use to practice and to patient outcomes? The next slide shares a little bit about current drivers in healthcare. So many things changing over the years, right? So many things: access, consumerism, cost. Cost is really important because when we think about how this shapes the careers of nurses that span many generations, we know our employers don't want to pay more. We know our insurance companies or payers don't want to pay more. And we usually don't want to pay more. So there's so many different confluence of factors at this point. The other piece, though, that I think is really important that we think about within this context of leading through and helping others, when we think about the past few years in the United States especially, you know, we've dealt with the United States being the epicenter of racial reckoning, right? Which has led us to really think about social injustice, disparities of health. We lived through a pandemic and are still living through it today, right? And currently we have the Russian invasion of the Ukraine. When we think about our workforces and people we lead, they bring their whole selves to work, right? Each and every day. And it's really important that we, as leaders who help, support, and coach, also think about that. The other big piece in healthcare has to do with burnout, right? It was here before the pandemic, and it's here through it, and it will be here after it. And the role of what so many people do is, how do we make it better than it was before the pandemic? When people say, we want it to be back to where it was, is that really what you want? Or do we actually want to make it better? So when you think about you and your role and what you do, what are you seeing as key drivers of change in your work environment? And we know that sometimes our personal environments are often tied with our professional environments because people do bring them whole selves. The other big piece of this has to do with time and the element of time and how much we're able to focus on the work that we do. The next slide talks a little bit about some of the drivers, right? And I think the data piece around this is really important. Oftentimes when we talk about the United States and the great wealth we have and opportunity, I think it's also important to put it in perspective of what do we look like from health outcome standpoint, right? So the next set of slides, which we'll go through each one, really talk about this data, right? Maternal mortality, right? How is this important, right? When you look at where we are as a country with the wealth, yeah, you can see here the comparable country average is 5.3. We are well above that, right? And there's a lot of good literature coming out around programs and how to reduce maternal mortality. The next slide talks a little bit about the percent of adults who report having experienced a medication error or treatment error. You can see the comparable country average. In the United States, we sit a little bit different. And when we think about the work of our systems of care, how much of it is it on paper? How much of it has to relate to interoperability? How much of it has to relate to only parts of a system, right? Maybe partly paper, maybe partly barcode med scanning, a variety of things of what might happen. And then when we translate some of that into the home care setting, how do patients engage with that, right? When we look at the literature, and I am not going to talk to you about adherence to medications, so critically important, right? Why do people adhere to medication regimens or not? What are the reminders? What are the tools? What are the costs, right? So much shifting and changing. Yet leverages amazing opportunity for nurses to develop solutions of care. The next slide talks about this age standardized disability. So one of the unique things often we see in some of the European countries, and we do look at here in the United States as well, is this age standardized disability adjusted life year. And really it reflects disease or a health condition, right, that are the sum of years of life lost due to premature mortality. And this is really important because if you look at us as a country, you clearly can see, again, we have a lot more health conditions and or diseases, right, that impact our ability to work, our ability to influence, and our ability to advocate, not just as a profession, but as a country to keep moving forward. The next slide talks a little bit about healthcare quality and access, right? So what does it look like? Many of you, right, we're all human beings. We all have loved ones who seek to access care. So what does access to care look like, right? Why do people choose an emergency room over an urgent care or a primary care? What does access to look like? And you can see here, the United States is behind, right? And this is important because all these different things impact cost, impact how we deliver care, where we deliver care, and ultimately impact those of us who deliver that care. The next slide talks a little bit about adults in comparable countries who have quicker access, right? We hear about this in the United States, and you probably, like I, have seen different headlines, especially over the last few years. New York State, you might know, pre-pandemic had an oversupply of nurses. Now you might be laughing to yourself and saying, oh my gosh, where did she see that? Well, there's national literature and bodies and reports that look at oversupply and undersupply. That was pre the pandemic. What's changing now? What's changing with enrollment? What's happening with retirements? There might be 4 million nurses, but 4 million nurses may not work all in a full-time FTE role, right? So what does access to look like? And that's just nursing, right? What does it mean for our advanced practice professional colleagues? What does it mean for respiratory therapy, our physicians, and other colleagues and team members we work with all the time to accessing care? So you can see we have some definite challenges here. And when we think about this through the diversity health equity lens, even more of a challenge. The next slide, and I promise we're getting through the data, but it's really important to understand this because Phyllis talked about the advocacy piece, which is critically important in the social media needs. And yet oftentimes it's not the nurses telling the best story of why we do what we do. And this is what's concerning for people who seek care in an emergency room, right? Seeking care there, primary care there, right? That could have been treated by a regular doctor, right? Primary care. But again, it goes back to access. So we are seeing this geographic landscape change in the United States around shifts, which is really important when we talk about quality care. The next slide, and really what I want to get into is change versus transition. When somebody says, oh, we got to change this, right? Internally, you know what that feels like. If I asked you to reflect back on your first 1 to 3 years of practice, you can remember changes. Sometimes changes are really good. Sometimes it's like, oh, they're done to me, right? It's done to me. I have to do it. I have no vote. I have no say. What does this mean? Yet when we talk about transitions, right, it involves our feelings, our emotions, right? And part of our work as leaders in shaping this and helping others and helping other leaders is how do we help make sense of it? How do we help people move through that change, right? With transitional steps through that process, which is so critically important. And it is a psychological experience. It's like Phyllis said, you know, the burnout piece, stepping back, closing in, not a good way because the only way to get through it is to move through it. And that's where having good colleagues, family, friends, whatever those outlets are so critically important. And being able to relate to people about that. You might be saying, well, Tracy, you're trying to shift my perspective, right? You're changing around the words. Does it make it easier? What is the actual situation that's happening, right? And we'll talk a little bit about that because I think that's going to be important. So on the next slide, we talk a little bit more about transition, right? And one of the key things you should all know is there is a transition theory, right? Which is really takes a look at any event, right? Or non-event that changes our relationships, our routines, our assumptions and roles. And with transition theory, which I know sometimes when we talk about theory, people say, oh, theory. But one of the key things with transition theory, it can be applied to our professional practice as well as our clinical practice, right? It talks about the situation. You heard from Phyllis about the self, right? And bringing the self to work. What are our personal as well as psychological perspectives on managing through change in those transitions, right? Do we have optimism? Do we have resilience, right? How do our social networks support us, right? So that we talk about the 4 R's with transition therapy: situation, self, support, and then strategies, right? What are those strategies? When I reflect back on my career and I think of young Tracy Gosselin, a nurse, I probably didn't have some of the best coping strategies, right? I was learning, I was trying to find meaning and why. I was trying to manage my stress and what those outlets were. Yet today, as we celebrate Nurses Week, I would not change a thing. And as I tell frontline nurses, 28 years in, I'm still proud to be a nurse. So when we think about barriers to moving through a transition on this next slide, I want you to think about what it meant to you as a frontline staff member, and some of you might be on the front line, right? When you think about your frontline experiences working in nursing informatics, experience as a nurse leader in a broad sense of the title of what that could mean, but also how you lead others. Because one of the key things, and you'll see this on the next slide, is really this fear of the unknown. So you probably don't know, but I am a Snoopy fan. I loved Snoopy growing up. And when you think about this, it's not so much that we're afraid of change or so in love with the old ways, but it's the place in between that we fear, right? The place in between. It's like being between the trapeze bars. You're swinging and you're going and you're hoping the other one's coming, right? And is it really coming? But what does that look like, right? The trapeze artists know the transitions, right? They know what that work looks like. But for us, sometimes we don't always do that, right? So it's Linus when his blanket's in the dryer, right? We never saw the closet, right? During the Snoopy episodes or the Charlie Brown episodes where Linus had a whole closet of extra blankets, right? It's his blanket when it's gone, right? We think about the book, Who Moved My Cheese, right? Who moved my cheese? Where is it, right? All these key pieces that impact how we work, how we do our work, and how we bring ourselves forward. The next slide talks about emotions, and emotions are one of these critical pieces. And what I ask each of you is, how emotionally agile are you? And how does that look personally when you're not at work, right? With family and friends, or on your own sometimes, because some of us do like quiet, and at work, right? We talk about emotional intelligence of leaders, and Phyllis talked to you a little bit about this, and I think it's a great topic to explore, right? We talk about emotional intelligence of leaders. How self-aware are they, right? Do they have good self-awareness? We also talk about self-regulation, right? Are they trustworthy, right? Do they have comfort with change? But they're also open to it usually. Another piece when we talk about emotional intelligence has to do with motivation, right? Motivation, critically important. It's more than just checking the box. We talk about empathy as a leader. Empathy is so critically important because one of the things is it helps us be present, it helps us hear, it helps us see, and helps us support, right? Which in no time in my career is that more critical. When I think about what I've seen within the nursing profession and serving as a leader for the majority of my career and what people need. And then our social skills. Yeah, I'll own it. I'm a little nerdy. I get it. But it's me. And that authenticity of who you are and bringing that. Phyllis said this well. We have to be who we are consistently when we are leading through emotions, because those we lead, those we work with, want to see consistency from us, right? So managing these emotions when they're coming at you, sometimes the best thing to do is that presence. But I think it also makes us pause and think about, who are we? Because we can't lead others if we can't lead ourselves, And I think that is a really important piece of where people need to think about, how do I shape? How do I influence? How do I help others if I can't manage my own emotions, right? And who is that trusted person for you? How do you work through these things and move through? We all have different pathways of how we manage through and work through things, yet being able to acknowledge that to yourself is so critically important. The next slide, when we talk about the relationship of these transitions and changes, right? What does it tie to? Current policy and processes, right? How does it impact the work we do, right? And when we think about that, and for frontline staff, what does it mean, right? What does it mean to me when things are changing, when we're going through a transition? Do we have guiding principles or values that help shape the work, right? Shape this transition we have to go through? And does it tie into a strategic plan, right? I don't think any of us would have said, let's have a pandemic, right? And tie it into the strategic plan. Yet, we all did rapid cycle change, PDCA, whatever tool you want to call it, but we all lived through that, right? The other piece is how has the change that we're going to process a transition for tied in with our shared governance and professional practice model? Critical pieces so people have input. One of the biggest things I often have seen when I've been at meetings or even in my own leadership and different things is that oftentimes what we hear is, here's what we're going to do, but we never recognize the people that served on the councils. Who were the other nurses? Who were the other clinical disciplines? We need others, right? We need others, and we need those other disciplines, but we never really highlight who was part of making that decision, right? And that is so critically important to hear the voice of the people who do the work, right? Because you certainly don't want me problem solving when I'm not the one taking care of the patient. But my job is to go and see and to understand and to advocate. The next slide is a study, which I think is really important. So what are the factors that affect nurses coping with transition? And this was an exploratory study. And the main theme they found from this was inadequate preparation for transition, right? And so 16 nurses, they went through and did a lot of qualitative exploration, hit data saturation. But what's really important when we think about these categories starts with training and development. Training and development. When you think about the generation of nurses that just started in the last few years, they came out of school. What did their preparation look like? Pretty different. Some never worked with patients in a clinical environment, right? Very different than probably how some of you and I were trained, right? COVID changed some of that. So what does their onboarding look like? We know onboarding is one of the most critical parts when we start to think about engagement, right? Decreasing turnover, right? All of those key pieces. So training and development, critically important. I'll never forget the day when I had the opportunity at my past employer in North Carolina to live through an epic conversion, right? I get it, epic, but it did feel epic. And working through with different staff, all the training we went through, all the learning we went through, all the skill building, right? It's not just about go here and do this. It's how does it work? The tactile piece of it. It's one thing to do a PowerPoint presentation, but it's really another thing to have the hands-on because not everybody learns with a PowerPoint. The other category was professional relationships. What does that residency program look like, right? So here's one of the pieces. We know nurse residency programs for new graduates are successful in helping nurses stay in the profession longer than they were, right? That's a really good thing for those first 1 to 3 years because it's really about grounding to the practice. Yet, you and I both know the opportunities are amazing in the profession these days for nursing and even outside where nursing can be a key contributor. What's their level of support from the charge nurse, right? What's their level of support from their nurse leader? right? And this is anybody in that care continuum, right? Anybody in their career. What does that look like? And do you have a leader who helps you work through things being integrated into your practice, right? How does that organization cascade change and understand multiple things that might be happening at the same time so the end user is not overwhelmed, right? Because we all know we can only learn so much. Accountability and commitment, welfare services, mainly relating to supports and other types of things, and then staffing, right? If there is one thing as nurses we really need to think about is how do we tell our story of who we are, what we do, and why we do it? Critically important to address the shortage so we can get enrollments up, because that is the key pivot right now on a lot of plots I've looked at nationally. How do we get enrollment up? How do we help ensure people want to be nurses? And I think that is a key piece for all of us to learn. As nurse managers, policymakers, we need to pay attention to factors that affect nurses' coping skills with transitions, right? We need to be aware of the staffing that impacts that, right? And that people feel they actually had a good day. So as we move into some other key pieces, the next slide talks about effective strategies and vision. And you've all seen this. You have seen strategies that go well, right? And they're still hard. They're still hard. Yet it all starts with vision. And leaders and the role of leadership is so critical, right? When we lead the front line as well as our leaders, we know we're in a place where the work environment, the digital transformation, and human transformation of what is happening is so critical. How do we understand vision, knowing that our vision needs to evolve over time? As leaders, we're not just performing today, we're also transforming, which is very different, right? Very different. We saw institutions, big, small, little, middle-sized healthcare systems, non-systems, the past 2 to 3 years do more than probably what they have done in 5 to 10 years, right? And so what does that speed of change look like, right? And so as leaders, we're performing. How do we get back to improving our sensitive indicators, fixing burnout, fixing staffing? But also we're in this leadership test of transforming, making it better than it was before COVID, right? As leaders, right, we look for viewpoints. We look to hear, right? We look to inform our vision. And you probably have also heard of VUCA, the VUCA model, right? Volatile, right? People need vision through that. Uncertainty, we need understanding. When things are complex, we need to break it down and provide clarity. And when there's ambiguity, right, we need to be agile, right? We need to flex and understand. So the next slide, we talk about model for leading complex change at scale. So it all starts with the vision, but it starts with the why. It shouldn't start with the how. Here's what we're going to do, right? The what and the how is what we usually see that comes first. But the vision, the why are we doing this, is so critically important. For those of you who like to read, some of you have probably already read the book by Simon Sinek, Start with the Why. And if you're not a book reader, he has many great TED Talks on the topic. But really, we got to start at the center, right? Why are we doing this, right? Then we can talk about trust in the who. We can talk about the what, that's probably informed by data. And we can talk about the how, the capacity, right? And really, people want to know what's in this for me, right? Oh, great. We're getting barcode med scanning. Excellent. I love that idea, right? Protects me. Protects me. Interoperability of Alaris pumps. Oh, wow, right? How does all this work? How does it help me as the frontline practitioner? How does it help our nursing informaticists, right? As we all bring our skills together to say, how do we lead the way to do things better? Please remember to start with the why. Because here's the thing, we're not trying to control the people, right? That Phyllis talked about control, right? Control, power, all of that. What we're really trying to understand is the situation, right? That's what we want to understand, right? And the situation, if not done right with engaged people, makes this whole model for leading complex change a challenge. So the next slide talks about, so what is it that people need to change, right? Not just for the front line, not just for our leaders, not just for me, but they need an awareness, right? They need to understand why we're doing this, right? We need to talk about it. We need to socialize it, right? We need to talk about the why. They also need to have a desire, and I get it, right? For people who are newer in their career, some people absolutely love changes that enhance their practice, right? We have some great technology and tools that can definitely help. Yet people need knowledge, right? How am I going to work through this? They need the ability. That goes back to the skills, right, in their role. And then the reinforcement. Sometimes, I don't know, I'd ask each of you at your institutions, how often is it, oh, we did it, done, off to the next intervention, off to the next plan change. When are we going to implement that one? But we don't go back and learn, right? We don't go back to hear what went well. How can we optimize this? What's the opportunity for the next piece of rollout that we do with something else, right? How do we see that, gather that, and take that to plan for the next? So critically important, because sometimes we don't want the feedback, right? Sometimes people might know what went well or didn't go well, and it's hard to hear. But being an authentic present leader, you realize much more of it is about the system than it is about you. So the next slide just gives you some tips on overcoming barriers to practice change, right? So barriers to practice, right? Different tools, different techniques, right? How do we provide user feedback, right? In nursing, feedback is a really good thing. As a discipline, nurses like feedback. One of the other pieces is when we think about the barriers to practice change, are we going to do all 1,000 beds at the hospital at once? Well, maybe we do a subset, right? Maybe we pick a few units that are either similar or same or different, depending on your philosophy, and test and learn, and then go to another group, right? Because some of that is how much can you as an institution handle when we talk about these types of changes, right? So it's really that learning, those feedback loops, which are critical when we talk about high quality care. Changing behaviors. Now, you all know, like I know, that is very hard. How do we shape and influence is more of what we do, because changing behavior is very hard, right? And so we talk about how do we educate? How do we provide tools to help people? But at the end of the day, changing behavior is probably one of the hardest things to do. So you really want to be sure through your planning when we're talking about practice changes that we're doing the right things up front to explain the why, right? Explain what it means to people, right? Have colleagues help them, if possible, explain the why, and find those key stakeholders that also help. The next slide talks about understanding and supporting clinical transitions. This is really important. And when we think about what are some of the evidence-based resources, right? We talk about preceptors, right? We talk about super users, right? Who are the people that learn it really well, that help everybody else? Nurse residency programs, and again, classroom training. But when we're teaching new skills, that ability to do hands-on is so critical. We also talk about the evidence-based practices, a variety. And I think this two-way feedback is critical, right? How do we coach? How do we support, right? Two-way feedback, listening, being authentic, coaching our preceptors, coaching our super users of new technologies, new clinical practices, around being able to engage in that dialogue and coaching. I don't know how many of you had a communications course in your undergraduate program. I did not, right? And so sometimes giving feedback can be pretty hard, even sometimes when it's feedback that might not be seen as positive by the receiver. So really important pieces that I think, as we think about the work we do, that's critically important. The next slide talks a little bit about models of change. And this is this consistency approach, right? There's a lot of models of change out there, right? You can go look at them, figure out how they work. Remember, start with the why. You know, one of the ones we all learned about in our initial nursing training program is the nursing process, right? We assess, we diagnose, we plan, we implement, we evaluate, and we might need to go through that. We know with the plan, do, check, act model, PDCA, that sometimes to get something to the right place, right, the outcome that is desired, we might need to go through 7 to 9 cycles of that. And as leaders, when we're coaching staff, getting that feedback at each point is so important, right? The end users of the work, all the key pieces. So I'll just tell you, I'm a fan of Cotter's 8 Steps of Change. Lewin's model has 3. Lewin's model is used a fair amount in nursing, especially when we talk about practice changes and policy changes that implement change. And I think it's really important to have these discussions because oftentimes it's, okay, here's the change goes forward. We don't have enough time to plan the transitional steps. And sometimes things aren't teed up together, right? They're not ready all at once. Cotter's 8 Steps is really good because it kind of creates that sense of urgency, right? What is the why behind this? You get a guiding coalition, right? The worst thing is me cooking up office solutions for somebody else, right? I really need to see and understand. The vision piece that I talked about earlier, right? Get your volunteers, right? Usually, you all know this better than I do. You're not the only one thinking, how do we find a solution? How do we find a solution? Because your volunteer troops are going to say, oh yeah, I'm ready to go, right? Enable action, right? What are the barriers? And sometimes some of the barriers can be people and stakeholders, right? Other pieces you got to work through. Sharing with people short-term wins. Sometimes we wait for the ultimate outcome, right? Sometimes we wait for the A+, but maybe we take the C, right? And that's uncomfortable. But maybe we take the C and keep on listening, keep on hearing to get to the B, to get to the A. Sustain the acceleration as we learn. And that's critical, especially when we think about solutions and work and changes that go across a care continuum. And then we institute the change, right? We institute the change. We look for the outcomes that we'd want to see. Yet, you and I both know it's not always easy. So the next slide talks about our roles in change, right? Our roles in change. Each of us has probably played a different role at some point in our mind. And I think that is really an important piece. We all play a role, and understanding this is so important, right? So important to those we lead, as well as our own understanding of how am I weighing in on this, right? Am I the driver? Am I the sponsor, right? These steps are important that we understand. Or am I the implementer? Am I part of the project management team and the team members, right? But then do I know who my steering committee is? Do I know who the sponsor is? Who can we talk to about this? We also talk about the enablers, which is sometimes that middle management and supervisor level. Also might be our staff, right? Depending on what it is that you're looking at within your organization, this can vary greatly, right? And we talk about the recipients, right? Ultimately, the end users directly and indirectly, right? One of the biggest pieces is we can never over communicate. Communicate. And when you think you're done, you better come back around again, right? Because we know we're never done. But a key piece for each of us is how do we master our own emotions, right? How are we mastering that ourselves, right? How tied in do we understand our own emotional intelligence? Because sometimes some of the changes that we have to plan these transitions for, right, to get to the other side, we may not like ourselves. So we have to figure out our own emotions so we can help lead those through it. We need to be sure we understand the why, because if we don't understand the why, that's a whole different set of problems that we're going to face. So some points for each of you on the next slide to consider, right? When you're the leader and we think about this, how do we tell stories, right? How do we tell the stories and share the knowledge? Each of us plays a critical role, and we've played a critical role in somebody's life at some point. Storytelling is one thing nurses are phenomenal at, right? Nurses have the ability to use their power of storytelling in the political sphere, the clinical sphere, right, with their professional societies, right? So how do we shape and tell the story? Lead people through the why, the vision, the points. How do we create dialogue, right? You know, this comes back sometimes to people being introverted. For your role, you might have to be a little more extroverted, right? Understanding what you need, right? Sharing emotions, right? Experiences, insights. Ask the what if questions, right? We say, ask that, right? Or ask the why 5 to 7 times if you really want to get down into the problem solving, right? To get that understanding. Set expectations, right? And take responsibilities for mistakes. I think one of the key pieces, Amy Edmondson, and I think, again, Phyllis, I don't know, you would think we were on the same line here. When you think about Amy's work around psychological safety, that is so critical to this, right? Are people okay speaking their truth? Can people say and ask questions, right? That tells you a lot about culture and how well what you're trying to do is going to work. And taking mistakes, the responsibility for them is very difficult, especially when people are afraid of failure. Most times, we don't fail on patients, right? We fail within our operational systems and processes, right? And really trying to unbundle that. And I think, you know, do you have awareness of your thoughts, right? Do you understand that? Having that self-regulation is really important sometimes in meetings, because we need to be able to say, maybe not right now, right? And then as leaders, I think sharing with others how we've grown and developed our coping abilities, right? Personally and professionally. I am certain each of you at some point has had somebody say, can I talk to you? Can I understand? How did you do this? How did you get to where you are, right? And I think this is important because one of the things is we want to help others succeed, right? I'm a firm believer, everybody needs a nurse, right? So how are we cultivating the next generation of nurses in leadership positions, right? Across the many areas in healthcare that are acceptable to us. So really this cross-boundary collaboration and work, I think, is so critically important. The next slide, well, your role in self, right? This has nothing to do with titles, because when we signed up to be nurses, we all chose to be leaders. We all advocate every day, from the bedside, the chair side, those who work in home health, and the car side or the home side, right? Leadership within buildings, leadership in a variety of ways today. But how well do you know your role? Right? How well do you know yourself, right? And I think these are critical pieces. I don't know how many of you are also a member of AONL. This week they released a podcast by Bernadette Melnick, who some of you might know, who's up at Ohio State. And I was listening to it while walking to work one day, and it talked about your 7 hours of sleep. And I was like, oh, 7 hours of sleep. Yeah, that'd be great. Like, am I waking up during the 7 hours? Am I having a thought at 2 a.m.? But it's really these pieces of, at the end of the day, how do we be our best self to those we lead and those we serve, right? And, you know, I always chuckle when it talks about negative self-talk, managing your caffeine intake, right? And I'm like, oh boy, how many cups of coffee, right? But I know, right? And you joke about it, but at the same time we think, this can be really hard sometimes, right? How do we take care of ourselves? And Phyllis spoke about this. You can't shut down. You've got to figure out how you're going to work through it. Some of us might have had the same path. Some of us might have different paths. And what worked before the pandemic maybe didn't work as well during the pandemic for each of us. So we found new opportunities and ways, right? And this is what we have to do with the workforce, right? How we lead them through it, how we lean into being uncomfortable, because through uncomfortableness, right, we build resilience, we build that comfort level. So as we head down the home stretch, resilience, right, myths of resilience, right, we talk about the next slide where we talk about the ability to bounce back, right? So there's some myths about resilience. Either you have it or you don't. Well, that's not really true, right? We know, right, that people can learn about resilience, right? We think about how we do this, right? It's our behaviors, it's our thoughts, right, and our actions. We learn, but we also get that from mentors, right? Mentors, right? Hopefully, somebody said to each of you someday, in their own unique words, of course, I believe in you and you can do this, right? Second myth when we talk about resilience really has to do with resilience and that people don't have problem, stress, or difficult emotions, right? Well, being resilient doesn't mean that we don't experience those things, right? But we work through the pain and the stress of pulling people through and the adversity and trauma, right? And sometimes our work environments are safer for people than their home. So people bring their whole selves to work, and how do we support through that, right? So the road to resilience looks different, right? And then the third myth really has to do with resilient people are tough and self-reliant, and they don't need other people. Well, actually, you know, we really, really do, because it's a great thing of needing other people. You know, and it's really this piece around the habits. And I think when we think about some of the work around the habits, right, it's that authenticity, being comfortable with who you are, the trust piece, right? Phyllis spoke about that. So, so important. The commitment to what we do, right? Compassion. One of the hardest things is letting go, right? But sometimes letting go helps us become resilient. At least I believe that. And it's really, you know, these key pieces of who are we, right? How do we relate? How do we help people through things? Knowing that change is here and change is really fast right now. So how are we building those transitions and supporting our teams? The next slide, I just asked each of you because I know I have many, many lessons learned, right, throughout my career. And I wish this was one of those things I learned earlier on, but I learned a little, you know, as I went along, and I had stumbling blocks, right? So each of us has lessons learned when we think about this. And yet, how do we share those lessons with others, right? What are those pearls, those nuggets, those diamonds in the rough that we just want to say, hey, let me give you some feedback on this. This might help you, right? So you don't maybe do what I did. So the next slide is some concluding thoughts. And oftentimes, and I put this in a box, it's about defining a new normal. And I think when we talk about defining a new normal, that means very different things to different people, right? Very different things. I like to think about making it better than it was before COVID. And I think that, to me, is what the new normal is about. Because it wasn't great before. I mean, maybe you would say it was. But we had burnout. We had stress. We had systems that didn't work. We had people who, you all know this, right? So think about the why. Create the context. Bring people along, right? Know your culture, right? Culture eats strategy for breakfast every single day, right? Not my quote, that came elsewhere. But it's so important. Use storytelling. Serve as a mentor or coach, but also have a mentor or coach, right? The other piece is this crosswork of our professional associations, organizations, and society. that we see. And really, how do we move nursing forward together, right? How do we move it forward together? Because so many of our societies, organizations, professional associations are all doing similar work, but how do we leverage that to truly tell the story of nursing? And most of all, take care of yourself, right? You have to have your joy in work because people notice that. People notice if you're authentically yourself and being able to do what you want to do. So lastly, on the final slide, we talk about joy, right? Because each of you plays a huge role with the people you work with, the people you lead, the people who are moving through different things with you. So joy, collected over time, fuels resilience, ensuring we'll have reservoirs of emotional strength when hard things do happen. So I thank you today. I thank the moderators of my session. I thank the New York State chapter of HIMSS for inviting me as the planning, and I'm happy to take a few questions.
Thank you, Tracy, so much for that motivational and inspirational speech and talk, and certainly your expertise, sharing your expertise today. We have quite a few questions in the chat, and hopefully we will get to them all. But a lot of people want to hear your thoughts on quite a few things. The first one's about change. Change is inevitable. How much time would you allocate to a new process, new solution, or implementation to assess what is not working and the need to pivot and re-strategize?
Wow, great question, right?
Yeah.
So this is going to sound silly, but it's ask the people, right? So we work in a discipline. If you're inpatient, most people around this country work 12-hour shifts. So I might work 9 to 12 shifts a month. That is not an easy time to understand what needs to change. Ambulatory settings, home care hospice might look different. Understanding and asking your stakeholders, right? How long, right? It usually takes, there's some literature that says 14 days, 21 days to create a new behavior. Well, 21 shifts on an inpatient unit, we can't change in a week or two, right? We need to understand a little bit better. We need to understand a little longer. In telling people, we're going to come back and get your feedback, right? Post up large white sticky sheets. Same thing in an ambulatory setting, right? Where people can put little Post-it notes or have something that compiles it electronically. You all know those tools better than I do, right? But giving it enough time and having that be part of your planning cycle, right? And that's why when we talk about models of change, ensuring, right? Why do I like the Cotter 8 step? Because I don't miss a step, right? Oh, unfreeze, refreeze, oh, have the change. You really want to be true to that because your people see that. And I think as you vet those changes, is it a whole care setting or is it one area, right? What's the magnitude of change, right? In the organization for the size, the scalability, and then the people. Is it a single discipline? Is it every discipline, right? Because as nurses, the work you do influences more than nursing. Some of you lead teams that represent a variety of clinical disciplines. So getting that voice, right, both from your front end stakeholders, so they're engaged, also from the committee.
Thank you. Great response. And the next one's a little bit long. How do you transition in a workplace when you feel like you have no upper level management support and are surrounded by people disinterested in improvement? And it kind of says small community hospital. There's a lot of travel nurses, disengaged direct management. And then there's one that just says piggybacking on that. What if you are in an environment where openness and new ideas are not welcome?
I had to jot a few notes on that one. Okay, well, that's a hard one, right? So there are the typical streams that I would encourage anyone. Work through your leadership team, right? Are you being shut down? It is very hard, I find, for nurses to play the game of leapfrog. People typically don't like to jump up multiple layers of supervision, because that takes courage, right? It's also talking with your other peers. Are you the only one who sees this? Usually in my experience, no. Usually others are very well aware. But if your leadership at the topmost level isn't engaged, one thing I tell people is that the right organization? And that hurts my heart, right, as a nurse, because there are people who are seeking care, right? And trying to engage the different levels of leadership, bringing the data, right? Bringing the data, the powerful piece of here's what is happening. How are we going to do this? And engaging in dialogue, right? Sometimes we try to fix and find solutions, or we're pretty good with Band-Aid approaches, but they're not sustainable, right? So see if you can engage in a conversation. Use your data to inform the process, to help guide, right? Be able to share, right, what the experience means to those you care for, right? Because institutions get reputations within the communities they serve, no matter how big, how small, and where they are, and why that is important to you, right? Why it's important to you as a professional nurse who works there. I think the worst, and as I said, the hardest piece is if the values don't align with you and the mission, and sometimes people have to leave. And that is probably one of the hardest things as a leader, as an individual team contributor, right? Because all play important roles. But it is very hard, especially for people who've been there a long time. And it's really being able to say, you know, we try multiple avenues as nurses. Nurses are fixers, right? Nurses are fixers. We like to fix. And we will find 10 different doors and we will go to each one. Number 11, finally, right? But there's only so much of that because you got to take care of yourself, right? You got to take care of your resilience because you don't want to be burnt out. You don't want to have joy, right? Sometimes change brings great joy.
Okay, we're going to get one more question. There are quite a few more, so we'll have to figure out a way to get back, but how effective communication is key. How might nurses who provide direct patient care gain opportunities to learn and use effective communication tools and strategies so that we are better prepared to share ideas effectively and clearly with others such as administration, management, physicians, and nursing informatics?
Oh, well, that is a phenomenal question, right? So communication is critical, right? I believe, you know, if you want to give me 50 PowerPoint slides, great. I'll take a look at it. I'll do what you need me to do. If you think you're going to share that with the front line, good luck, right? Like, how do we effectively use YouTube videos, right? Because I can guarantee you 50 slides I can distill in 2 minutes in a video, right? Don't make me read all that jargon. Hit me with the why, like what are the facts, right? The slide I shared with you that said, start with the why, the little glasses, you got to start there. Now, I would say to all of you, you are the technical people who understand it better than I do, right? I struggle with this thing some days. So here's the thing, look and partner, right? Look and partner at what the tools are, use videos, engage the front line and ask them, how do you want to learn about this? Right? How do you want to learn about this? Wow, I wish when I started out, somebody told me that, right? Versus watching a chest tube dressing change on a PowerPoint, like would have been good, would have been really good, right? So work with your colleagues, go to your shared governance councils, right? The professional practice model, use that. Then the tools, right? Partner to promote, to learn how to use them together.
Yeah, great. Great advice. Thank you so much, Tracy. Thank you for this wonderful presentation today. We're going to move to our self-care again. So please stretch and hydrate, and we'll introduce the next moderators for the next panel.